Why X-rays, not ultrasound, are the first step in diagnosing knee arthritis. Hi, I am Dr. A.K. Venkatachalam, Madras Joint Rejuvenation Centre. In this video, I am going to emphasize a very basic aspect of orthopedic surgery. That is, what investigation should a doctor perform when a patient comes to his clinic with the symptoms of knee osteoarthritis. Although it is like going back to first standard, but I found it necessary to explain all the malpractices which are prevalent in the city. When a patient comes with knee pain, the first and most essential investigation is a weight-bearing X-ray of the knee. It's simple, inexpensive, and gives a clear picture of the joint space, cartilage thickness, and bone alignment. Here's an X-ray of the knee showing joint space narrowing, osteophytes, subchondral sclerosis. Today I'm going to discuss the X-rays of a patient with osteoarthritis. We have just seen the patient's testimonial and these are the X-rays. Normally when a patient comes to my clinic, I get an X-ray done. This is the standard practice with orthopedic surgeons. If I want to proceed to further biological treatments, then I order 3 Tesla MRI scans. This is a standard practice. So on this X-ray, I'm going to show you the findings and explain the grading of osteoarthritis. These are the standard AP X-rays of a patient. I take X-rays in 3 planes: AP, lateral and merchant skyline views. The X-ray changes in osteoarthritis are classified by a system called Kellgren-Lawrence. This patient is 56 years old and she has involvement of both the knee joints. The grading here, this is the thigh bone, this is the leg bone, this is the joint. Osteoarthritis is primarily a disease of cartilage and bone. And these are best visualized on X-rays, not on soft tissue scans, which ultrasound unfortunately is, nor on sophisticated investigations like MRI, which may be a very useful tool, as I will discuss later in another video. Let's understand how doctors interpret these X-rays using the Kellgren-Lawrence grading system. The Kellgren-Lawrence grading system is a system which grades the severity of the osteoarthritic knee into 4 grades. 0, there is no arthritis; grade 1, grade 2, grade 3 and grade 4. And this is what doctors tell patients, that you have grade 1, grade 2 and grade 3 or grade 4. And in the early stages, you may do away with rest, exercises, painkillers. When it is 2, 1 or 2 and it is needed, you can give PRP, and when it is 3 or 4, I recommend PRS treatment. Kellgren-Lawrence grading of knee osteoarthritis. Grade 1, doubtful osteoarthritis, just tiny osteophytes or bone spurs, nor the joint space, the space between the 2 bones is normal joint space. Grade 2, mild osteoarthritis, definite osteophytes, minimal joint space narrowing. Grade 3, moderate osteoarthritis, multiple osteophytes, moderate narrowing, early bone deformity. That is, there is more advanced joint space narrowing. Grade 4, severe osteoarthritis, large osteophytes, marked joint space loss, bone-on-bone contact. This grading helps us decide the right treatment, from physiotherapy and biologic injections in early stages to joint replacement in advanced cases. Unfortunately, some pain physicians in Chennai have begun promoting dynamic ultrasound scanning as a substitute for X-rays. These are standalone pain clinics with no facilities like X-rays in their clinic. It's just a single room, and all they have room is to have a portable or a fixed ultrasound, and they claim that it is the latest or more advanced method. But this is misleading. Ultrasound may show fluid, tendons or ligaments. It is also useful for injection of substrates like PRP, bone marrow or harvesting bone marrow, injecting bone marrow, SVF, but it cannot assess joint space narrowing, cartilage wear or bone alignment. Using ultrasound instead of an X-ray for osteoarthritis is like trying to judge a car's engine by looking only at the tires. It's a cranky, unscientific practice often used to impress patients with technology while skipping the correct basic test. Some others order an MRI as the first test. Again, unnecessary. MRI is useful for ligament or meniscal injuries or assessing the degree of osteoarthritis, that is particularly 3 Tesla MRI for assessing the degree of osteoarthritis into 4 grades, assessing bone marrow edema, fluid, etc. In the normal case, it adds little value for initial assessment, particularly if you are not going to proceed with stem cell or SVF injections. It's expensive. MRI is expensive. It's time consuming and often overkill when a simple X-ray gives all the information. The correct approach is clear. Get a weight-bearing knee X-ray first. It shows the real load-bearing condition of your joint. Ultrasound and MRI have roles, but only as supplementary tools, not substitutes. So remember, when you have knee pain, insist on an X-ray first from your doctor. It's the gold standard and it guides the right diagnosis and treatment. Don't be misled by flashy but irrelevant scans, particularly ultrasound scans. Accurate diagnosis begins with the right image, a plain X-ray. I am Dr. A.K. Venkatachalam. I am an orthopedic surgeon with special interest in orthobiologic surgery. My practice is known as the Madras Joint Rejuvenation Centre. If you found this video useful, give it a thumbs up, share it with your friends who may be suffering from osteoarthritis, subscribe to my channel and press the bell icon to receive notifications when I upload videos like this in future. See you in the next educational and insightful video. Bye.